Did you know that all of us, regardless of age, have worms, and it is recommended to undergo deworming at least once, if not twice, a year for optimal health? Do you want to know a natural, simple, and easy to make treatment that eliminates more than 100 types of parasites? In this video you will discover. First and foremost, I would like to inform you that this video is a public service video, alright? There is crucial information that individuals need to be aware of regarding worms, alright? The majority of individuals do not consider it and only begin to be concerned about worms when they are experiencing symptoms associated with worms or when it appears in a stool test. But it may be that this only appears that you only show symptoms or appear in the stool test when you already have a lot of worms, okay? And the ideal would be that we do at least once or twice a year a deworming process so that you can control and reduce it. As I previously explained, each of us has worms to some extent, but it is crucial to control their population to prevent an excessive infestation. In any case, these worms ultimately drain our vitality, leaving us with compromised health. Furthermore, many people are unaware of this issue until they have a significant number of worms and begin exhibiting symptoms. It is only at that point that they become aware of the problem and its impact on their well-being. So, the majority of individuals, including adults, not just children, do actually possess worms in their bodies, okay? Is that clear? And for you to have an idea, the stool test has a sensitivity of 10%. Indicating that you would need to conduct it at least 10 times in order to ascertain whether or not you have worms in your system. So, when the stool test shows that a person has worms, it means they already have a lot, okay? Or it reaches the point sometimes of people seeing a worm in their feces, it came out with the feces. This shows that the person already has a lot of worms in their body, because they have already lost a lot of health during all this time. The worms were taking nutrients, hurting their intestines, causing inflammation, causing a lot of damage to their health, okay? Until finally the person realized. So like if you had a stool test and it didn't show anything, it doesn't mean you don't have worms, okay? You would need to complete a minimum of 10 examinations in order to have a very high probability of not having a significant number of worms if none of the 10 examinations have indicated their presence, okay? However, you cannot solely rely on the stool test. Therefore, let us now discuss certain symptoms that individuals may exhibit, which are typically indicative of a worm infestation. The first one is iron deficiency anemia, that is, anemia due to lack of iron. Why? What do worms do? They attach themselves to your intestines and literally suck the blood and nutrients from the person, causing injury and damaging the intestine. So, one of the possibilities when a person has iron deficiency anemia already raises an alert to check if this person does not have worms or if they do not have a lot of worms. As I mentioned, most of us have some level of worm. Another issue would be a person who presents weakness, discouragement, is already a little more devitalized. This can also be an indication. Another sign is the individual who is experiencing rapid weight loss, which is caused by the worms. So malnutrition could be a possible consequence of this. Another question, the person who has a very big exaggerated hunger, so they start wanting to eat a lot of food. This can happen because the worms are there sucking up the nutrients, so she needs to feed not only her body but also these parasites. Here guys, I'm talking about a series of factors that can indicate the presence of worms, okay? Insomnia problems or problems sleeping can also happen, okay? The worms remain there, wriggling in the body while individuals are sleeping. There are worms that can even have an impact on the brain. Scaling skin problems in the person can also be an indication. Abdominal pain without any known cause, that is, the person does not know why they are experiencing these pains, has already investigated, found nothing. Why? Why can this happen? Because the worms, as I said, they hurt the walls of the intestine there. This then generates pain. Another issue would be a very large lack of appetite. It could also indicate worms. Precisely because the person's intestine is injured there, it is hurt, so she loses a little appetite because of this intestinal discomfort. And another problem could also be individuals who have a highly distended abdomen, and also individuals who experience diarrhea and vomiting. Alright? So, there is a panorama of several signs there that may indicate that the person may have worms if they present one or more of these symptoms. But then people can say, no, but I take care of myself, I wash my hands, I wash the vegetables, the greens, okay? However, gentlemen, we frequently encounter numerous sources that have the potential to introduce worms into our bodies. And remember that the eggs of those worms there, they are microscopic. You can't see them in the salad, in the food, in the water, okay? You can't see it, but they can be present in all of this, right? In water, in food, when you eat out, depending on the place, if they don't do the correct sepsis, vegetables, we have already spoken. When shaking hands, if the person lacks proper hygiene. Many people don't wash hands properly after using the bathroom, neglecting hygiene. Another approach is, in the event that you walk barefoot in environments that are contaminated, this can also occur and pose a risk. Consuming raw or undercooked meat as well. In any case, there are numerous ways in which we can come into contact with worms on a daily basis. Therefore, the most suitable course of action is to emulate the practices of the ancients, which is to deworm on an annual or biannual basis, okay? I believe the best option is to have two, so you can always control the worms. Since the proposal I'm referring to here involves a natural treatment, it's even more advantageous, okay? Remember that if you have a multitude of pets, such as a dog and a cat, if you work on farms, for example, with animals like cattle, cows, chickens, pigs, and so on, as well as sheep. So, there is even more reason for you to make sure you do this deworming procedure twice a year. Now I'm going to explain how this natural protocol works, remembering that here is more for information so you know this exists. And this is a standard protocol for a healthy adult. In your case, if you want to know for your case, the ideal is that you have a consultation with a healthcare professional you trust, who will then correctly guide you for your individuality, for your case, how you should proceed, okay? Due to variations among individuals, people can have different diseases. Therefore, if a person has already had a disease, all of this must be taken into consideration when administering any type of treatment, okay? So, here, this video is for general information for you. So, this natural protocol was created by Dr. Huda Clark, okay? She studied many years ago how to deworm people, alright? She believed this was a significant issue in humanity at present. Therefore, she devised a natural protocol that, in theory, has the potential to eradicate over 100 different types of worms, and this protocol is comprised of black walnut, clove, and wormwood. These three ingredients. You can be manipulating this, or even better, buying it already ready. For example, the brand Now. Foods presents the tincture already ready for you to do this protocol. I will even leave the link down below in the comments section where you can easily find this dye that I am referring to. The protocol then, it is done for 30 days, okay? The person then needs to take this tincture for 30 days. They need to start on the new moon and go through the full moon. Why is that? Because during the full moon, worms emerge from the ground and migrate to reproduce. So at this point in time, when they depart, the fabric is when you are able to then eliminate a greater quantity of worms. If you do it in other periods of other moons, let's say, you ultimately end up not catching all the worms. But that's very easy, so just search there on Google Lunar Calendar that you will easily find. So, with this protocol, you need to start with a lower dose and gradually increase it. Take on empty stomach, for instance, morning on empty stomach, 30 minutes before breakfast, end of day 30 minutes before dinner. It would be on an empty stomach. So basically, how does it work? You will take it on the first day of treatment, and you will take 1 drop diluted in 200 ml of water 30 minutes before breakfast and 30 minutes before dinner, okay? That is 1 drop twice a day, always diluted in water. And so you go, on the first day it's 1 drop, on the second day it's 2 drops, on the third day it's 3 drops, and so on until you reach the 30th day, where you'll take 30 drops diluted in water in the morning on an empty stomach and before dinner on an empty stomach, okay? That is essentially the protocol. And one thing that the individual needs to be conscious of is that if by any chance they begin experiencing any kind of insomnia or headache during the treatment, this may indicate that numerous worms are dying simultaneously. And when these worms perish, the body requires to eliminate this process. So if you terminate numerous worms simultaneously, that can result in, as I mentioned, headache, insomnia. And the ideal is to reduce the dose so that this does not happen. Remember that here I am passing this only for information so that you know that this exists, and that the ideal is that you have professional guidance, going through a consultation to understand exactly how to do it, in your case, to have the best results. So that's it. A hug, and see you in the next video.